Did you know? Even a common painkiller like ibuprofen, naproxen, or diclofenac, which many elderly people take for headaches or joint pain, can cause facial swelling, itchy skin, or silent cramping stomach pain. These seemingly minor symptoms, if not recognized in time, may lead to kidney failure, gastrointestinal bleeding, or even stroke, especially dangerous for older adults. You are not alone. Millions of people over the age of 60 in the US, UK, and Australia use NSAIDs daily, without realizing that their side effects may silently erode their health little by little. So, what exactly are NSAIDs? Why must older people be extra cautious when using these medications? Today, we'll break down clearly, practically, and accessibly the three most common NSAIDs: ibuprofen, naproxen, and diclofenac, along with important medical warnings tailored specifically for the elderly. What are NSAIDs? NSAID stands for non-steroidal anti-inflammatory drugs, a class of medications widely used for pain relief, fever reduction, and inflammation control. Among them, ibuprofen, naproxen, and diclofenac are the most familiar to older adults. These are medications that many seniors use almost daily to cope with arthritis degeneration, rheumatoid arthritis, back pain, muscle aches, or mild fever. Mechanistically, NSAIDs work by inhibiting enzymes called cyclooxygenases, QX1 and QX2, which are responsible for producing inflammatory substances in the body. By blocking these enzymes, symptoms such as pain, swelling, and fever are noticeably reduced. This makes NSAIDs a quick and convenient choice for those with chronic pain, especially the elderly, who often suffer from ongoing joint issues. In the U.S., according to the CDC, more than 30 million people use NSAIDs daily, most of whom are over 60. In the UK and Australia, NSAIDs are also among the most commonly prescribed and over-the-counter medications for elderly patients. The reason is simple. Aging brings a host of problems, such as arthritis, spinal degeneration, neck and shoulder pain, and chronic headaches, prompting older adults to turn to pain relievers just to maintain daily activities. However, and this is crucial, the elderly cannot metabolize drugs the same way as younger people. Liver and kidney functions decline, stomach lining becomes weaker, and the cardiovascular system becomes more vulnerable, making the side effects of NSAIDs far more dangerous than in younger individuals. In many cases, patients feel better immediately after taking the medicine without realizing their liver is working overtime, their stomach lining is being eroded, or their face is swelling due to water retention. Some symptoms only emerge weeks or months later, making it hard to trace the cause back to NSAIDs. So what are the common side effects when using NSAIDs? 1. Skin rash or hives. The most common allergic reaction to NSAIDs is hives, often appearing on the chest, abdomen, arms, or face. Initially, these show up as small red bumps that spread and cause intense itching. In older adults whose skin is thinner and immune response, weaker rashes may spread faster and last longer than in younger people. Some may also experience burning sensations or mild swelling in the affected areas. If the medication is stopped in time, the rash usually clears up within a few days. But if use continues, the red spots may develop into blisters, ulcers, or peeling skin, leading to pain and increased risk of secondary infections. 2. Facial, lip, or limb swelling. A severe warning sign, angioedema is a more serious allergic reaction often seen in the elderly after taking NSAIDs. It's characterized by swelling of the face, eyelids, lips, tongue, or limbs, sometimes appearing within 10 to 30 minutes of taking the drug. Swelling isn't just a cosmetic issue. It may signal a systemic allergic reaction. If the swelling spreads to the throat or tongue, the patient may experience difficulty breathing, wheezing, speech problems, or even death if not treated promptly. This condition is especially concerning because many seniors may mistake it for food allergies or weather changes. 3. Itching, all over or in isolated areas. Another commonly overlooked allergic symptom in seniors is unexplained itching, especially on the back, chest, neck, or scarred skin areas. Many elderly individuals think it's due to age or dry weather and continue using the drug, unknowingly worsening the problem. However, intense itching after taking NSAIDs, especially if paired with rash or burning skin, is often an early sign of a drug allergy. If left untreated, the itching may become persistent spread and interfere with sleep, seriously affecting the person's mental well-being. 4. Contact dermatitis and light sensitivity reactions. Some people may develop contact dermatitis after using NSAIDs, particularly topical Diclofenac gels, presenting symptoms like redness, burning blisters, or a mild burning pain in the application area. A lesser-known but relatively common side effect is photosensitivity. After taking NSAIDs, the skin exposed to sunlight, especially on the face, neck, and hands, can become red, swollen, itchy, or rash-like even after very short sun exposure. This is particularly dangerous for older adults, as their skin is more fragile and heals more slowly. 5. Anaphylaxis. A life-threatening emergency. Anaphylaxis is an extremely serious allergic reaction that can occur after just one dose of ibuprofen, naproxen, or diclofenac. Although rare, its consequences are severe, especially for seniors with heart issues or unstable blood pressure. Classic symptoms include difficulty breathing, wheezing, chest tightness, rapid heart rate, pounding heartbeat, sudden drop in blood pressure, dizziness, fainting, swelling of the lips, tongue, or throat, nausea, vomiting, or acute diarrhea, loss of consciousness. Within minutes, if not treated immediately, the patient can die. Alarmingly, anaphylaxis can occur even in people with no prior drug allergies. 6. Stevens-Johnson syndrome and toxic epidermal necrolysis. These are two extremely severe skin reactions, though rare. However, they carry a high mortality rate, especially in the elderly. A few days after taking the drug, the person may develop high fever, sore throat, fatigue, along with small blisters, red eyes, and lip ulcers. These blisters soon spread, rapidly burst, and the skin begins to peel like a severe burn. In toxic epidermal necrolysis, more than 30% of the skin can be affected, requiring burn unit level treatment. NSAIDs are among the top drugs linked to these conditions, especially when taken in high doses or combined with other medications. Seek medical help immediately if you experience any of the above symptoms. Why are older adults more vulnerable to NSAID reactions? The elderly body no longer functions like it did in youth. Vital organs like the liver, kidneys, and the immune system all decline with age. This is precisely why older adults are more prone to side effects, especially from NSAIDs like ibuprofen, naproxen, or diclofenac. First, the liver and kidneys, the body's drug processing centers, work less efficiently after age 60. This slows down drug metabolism, allowing more of the drug to accumulate in the bloodstream, increasing the risk of toxicity or allergic reactions. Second, the aging immune system becomes hypersensitive or dysregulated. Some individuals may trigger allergic responses from even small doses. Reactions like facial swelling, rash, itching, or shortness of breath may occur suddenly and with greater severity. Additionally, older people often take multiple medications for chronic conditions like hypertension, diabetes, or heart disease. The interaction between NSAIDs and these drugs can further raise the risk of side effects, including allergic reactions. Therefore, seniors should use NSAIDs with extreme caution, monitor for abnormal symptoms, and always consult a doctor. Final advice: do not self-medicate or reuse old prescriptions without updated medical advice. Closely monitor any unusual symptoms after taking NSAIDs. If long-term NSAID use is necessary, talk to your doctor about adding stomach-protecting medications, exploring alternatives like physical therapy, acupuncture, or less harmful pain relievers. If you found this information helpful, hit subscribe to follow our channel on a journey to protect the health of older adults. Every week, we'll share more easy-to-understand practical and relevant health knowledge. Your health in old age is priceless, and you deserve the best care possible.